Good morning. Hi, everybody. I always love trying to start a panel in a room where everyone's fired up and they've got a lot of thoughts and ideas and they're sharing with each other, because what it says is you guys are going to have a lot of thoughts and ideas for us. Am I right? There are thoughts and ideas out here about coordinated entry and equity. Okay, good. So the way this morning is going to work, I'll introduce myself. My name's Elaine de Coligny, and I am a COC advisor for Monterey and San Benito County COC. And I've been working with them on governance and some equity issues, and I'm honored to be invited to moderate this panel. I'll let the panelists introduce themselves in a minute, but our goal is to talk for about half the time we have together and share with you our understanding of what's going on with coordinated entry and equity, and then have half the time via dialogue in the room. So we've got some staff here supporting us. The staff in the room, can you raise your hands? Great. Katrina and Oliver over there. Good. So when we get to the point where we're talking back and forth, we'll move one of the microphones or both of them around the room so we can chat together. And just a reminder, we are all in this room on the same team, the team of preventing and ending homelessness. So let's say the things that need to be said, but be kind, because everyone here is a human being, and be respectful and listen and open. And with that, I'm going to invite the panelists to introduce themselves.
Good morning, Ed Cabrera. I'm the field office director for HUD. I'm based in San Francisco, covered Northern California. I've also spent about 24 years now in federal service. About nearly 10 of those were single issue on homelessness with the U.S. Interagency Council on Homelessness serving the region. So great to be here. I actually, when I first started at HUD, I spent a lot of time working on behalf of the department here in the Salinas Valley and working to reach out to migrant and underserved rural communities. So great to be back.
Good morning. Welcome. My name is Enrique Arreola. I am Deputy Director for San Benito County Health and Human Services Agency. Our division is Community Services and Workforce Development. I've been this capacity for 15 years now, since 2008, and our division has been providing homeless services for over 40 years. And over the last 10 years has really picked up. There's a huge challenging to address the needs of our homeless community, especially in finding permanent housing. And our goal will always be eliminate homelessness in Monterey and San Benito County through partnerships, as we are here. So there's a lot of work ahead, and I'm happy to be part of this team.
Hi everyone, Alicia Lehmer. I work with Homebase. We are a national technical assistance provider, and I've been doing this work for a little over 8 years, helping communities across the country with all different aspects of addressing homelessness, including redesign of their coordinatory systems and evaluation. And I have worked with Monterey in a couple different capacities as the 100-Day Challenge coach for their challenge to prevent and end youth homelessness, youth homelessness demonstration program, technical assistance provider, and now helping with redesign of the youth coordinatory system. So you've seen a lot of me over the years.
Hi, good morning, everyone. My name is Moriah McGill, and I work for Northern Circle Indian Housing Authority. We're a tribally designated housing entity that works to carry out homelessness and housing services on behalf of 8 federally recognized tribes in California. So I've worked at my organization for 10 years now. I started as the receptionist, moved to a construction specialist, to a housing developer, and now my sole responsibility is to find and secure grant funding to ensure that all of our housing programs have services. Really grateful for the opportunity. I did just want to say there are 58 counties in California, 44 COCs, and 110 federally recognized tribes. So I'm really grateful for the opportunity to be here today. Thank you.
Thanks, Lauren. All right. What a panel, right? So great. So, a couple of things. Inspired by my adult children, I have written my questions on my cell phone and will try to read it. So, first time for me. And the other thing I want to say is we are all vulnerable to alphabet soup. So, if anybody in the audience hears one of us use a set of letters that they think, what is that? Please just raise your hand and that'll be a signal to us to wind it back and say COC stands for Continuum of Care, or CARS stands for Coordinated Assessment Referral System. So feel free to raise your hand. We don't want to race by with any terms that folks don't understand. Okay, thanks. And with that, we'll get started by my asking Ed to remind us all why HUD decided to require continuums of care, and HUD, Housing and Urban Development, continuums of care to implement coordinated entry. What did HUD want to accomplish, and how did HUD expect coordinated entry would advance equity for people experiencing homelessness?
Thank you, Elaine. I think that's an important question in terms of setting context, and I'll try not to be too long-winded with this response. It really started, if you look back to the time where the Interagency Council on Homelessness, of which Helene represents, was revitalized back, ironically, during the George W. Bush administration between 2001 and 2009. At the time, we in federal government were attempting to leverage a very narrow objective, which was ending chronic homelessness, and using the limited funds that we had at the time to drive results, and more importantly, increase innovation at the local level. Innovations like Housing First at the time, permanent supportive housing, diversion courts, innovative models that we have kind of come to accept now as part of how we operate. And one of those innovations was this idea of no wrong door to accessing a local system of care, a crisis response system, what we now know to be coordinated entry. And communities all over the country had started tinkering with this, trying to refine it. And we at the federal level realized that this was something that we needed to focus on. Access and equity. We weren't necessarily using the term equity then, but certainly we were attempting to articulate it, or at least start to, in our policy and in our regulations. Further on, moving into the Obama administration in 2010, USICH established their first federal strategic plan to end prevent and end homelessness, called Opening Doors, set ambitious goals, but more importantly, with regard to this topic, also prioritized the development of comprehensive crisis response systems. So that included innovative types of system coordination efforts like coordinated entry. Coordinated entry was still a relatively new concept then. But communities, as I mentioned, had begun the work of creating this innovation, and they were receiving additional funding at the time. If you recall, the American Recovery and Reinvestment Act had committed funds through the Homeless Prevention and Rapid Rehousing Program, and that led to more investment in this and other innovations. In 2012, who's familiar with the interim rule that started talking about the coordinated entry? You don't count, Elaine, but that is the rule that HUD established that essentially codified what we know today to be coordinated entry. At the time, we called it centralized or coordinated assessment and coordinated assessment system. And really, it was the first time that HUD required continuums of care across the country to establish and operate coordinated entry systems at the local level. Why did we do this? For 4 reasons. First, to increase the efficiency of local crisis response systems. We saw that a lot of systems at the local level were disjointed, and we needed to create a level of scale and efficiency. And 2, and this speaks to the emergence of our focus on equity and access. We decided that improving fairness and easing access to local systems was paramount. And we had to articulate that in our regulations, and do it not just for the targeted homelessness assistance that continuums of care receive from HUD, but also for our mainstream assistance programs, things like the housing choice vouchers and entitlement programs. It's important that we use the breadth of our resources to move the needle on homelessness. Lastly, we wanted coordinated entry to serve as a tool for communities to get the information they need to respond more nimbly, to have information around service needs in their community, gaps in their system, so that they can reallocate resources when needed and as necessary, and then also so that they can identify needs for increased investment based on that data. So that's what the interim rule did in 2012. It really set the basic parameters for what HUD would like coordinated entry to be in communities. And for those reasons, HUD then, about 5 years passed, and by 2017, we had started to learn a lot about what works in terms of effective coordinated entry. So HUD issued a follow-up notice to really articulate and codify what we learned, and institute more requirements that were based on what we saw worked. It was working in communities. And that was a CPD notice 17-1, which is a public document. Certainly I can provide those resources. And I think what we saw as a result of that was more targeted and intentional focus on putting equity at the forefront of what we do. And the rule certainly talked about fairness, ease of access. It required also that continuums of care focus on their entire geography. So you should have access to your system regardless of where you live, not just if you live in the big city or the major population hub. It also required the continuums of care focus on making their systems available for victims, domestic violence, dating violence victims, sexual assault survivors, and the like, and creating a system, whether they were accessing DV-specific provider supports or not, so that they have access and equitable access as well. The 2017 notice also articulated protections based on one's protected class. For those of you not familiar with the Fair Housing Act, that includes protections based on race, color, national origin, familial status, disability, and am I missing one? Sexual orientation, religion. I think I got them all. And what that also did is it gave us a platform to articulate protections based on one's disability through the Section 504 Rehabilitation Act. Folks with disabilities are protected from discrimination in HUD assisted programs. Title VI of the Civil Rights Act protected folks based on race, color, and national origin in HUD assisted programs. And then, of course, there was Title II and Title III related to the Americans with Disabilities Act that provided additional protections for folks with disabilities looking to access programs. In addition to that, I'll mention, because it's important that we include this population in our equity lens, is that through HUD's equal access rule, HUD made discrimination in eligibility determinations unlawful when considering notions or perceived or actual related to one's gender identity, sexual orientation, or marital status. So all of this to say that continuums of care have a lot to consider in terms of moving forward in an intentional, fair, equitable way. The 2012 rule started that work, but the 2017 notice deepened and specified what that meant more clearly. There were, thinking of equity broadly, I would also mention that there was also a focus on making sure that we didn't use perceived barriers or service resistance as a way to screen people out. So the notice makes that clear, that the goal should be to screen people in, not screen people out based on lack of income or a certain history, be it with substance abuse, lack of credit history, criminal record with a few exceptions, and other factors, whether they have lease violations. So the idea was to make low thresholds to entry and to access. I'll mention a few other items. Marketing protections were an expectation of continuums of care. So it wasn't enough to market broadly, but also to keep in mind one's protected class and one's subpopulation, whether you're a homeless veteran or a mother with 2 children or an individual or someone who's been on the streets for years with co-occurring disorders. It shouldn't matter what your status is, whether you speak English or not. You should have an equitable access to your system of care. I'll try to move quickly here because these are really the experts here, not me. We also put language in the notice related to equity in evaluations, and that included requiring continuums of care to solicit feedback by way of surveys, by way of focus groups, by way of interviews that were representative of the diversity in the population. So this was a representative sample that really reflected the diversity of the population you're looking to serve. And then taking that feedback to improve the coordinated entry process in your community. So doing something with what you've learned. A couple of other principles that were articulated were the use of accessible tools and processes when assessing and referring people into the coordinated entry process. And then, of course, asking continuums of care to be sensitive to people's lived experience in every aspect of how they enter into the coordinated entry system. So that included both assessment tools and how they administer their delivery protocols. They have to be trauma informed. They have to really focus on minimizing risk and harm to folks, and then addressing potential psychological effects as a result of their being a part of this process. So is it enough? We found out in 2019 that it isn't. We still have a lot of work to do. Through the annual homeless assessment report that HUD puts out annually at Congress's direction, we learned that out of all homeless people in the country, when you look at African-American populations who are homeless, they're disproportionately represented in the homeless population. 40% of folks who are homeless in the US were African-American in 2019, while they only represent 13% of the community. We saw a similar, not as acute disparity when we looked at Latinos. 22% overall of the homeless nationally, 22% of them were Latino, whereas they are representative of only 18% of the population. So I think those, in terms of racial equity, it shows that we have a lot more to do in that regard. And certainly part of why I'm here is I need to hear from you all about what is working, what isn't, how we can, improve how our regulations, our requirements, and more importantly, what we need to remove or take away. If we can get out of your way, and if I can help carry the water in that regard, I'm happy to do that.
Thanks, Ed, for laying the groundwork. Does anyone else want to add anything on HUD's policy? Or I'd like to turn now to Alicia as someone who has trained communities on coordinated entry, break down the basic components and sort of give some examples of what those components look like in communities. Thanks.
Yeah, absolutely. So there is this national HUD requirement for coordinated entry, but it's also a local process. It's a local system. There are key components of that system that are very consistent across coordinatory systems across the country. But it is meant to be locally reflective, community driven, and developed. So those key components are access, so the front door of the homeless response system, assessment, which really looks at vulnerabilities and needs, prioritization, which this is really getting to the core of coordinatory, which is that we just simply don't have enough resources for everyone in need. So coordinated entry is intended as a way to more equitably and effectively connect folks to the resources they need at the right time with the right intervention, as quickly as possible, acknowledging those different needs. Then you have referral, which is when someone reaches the top of the prioritization scheme, the prioritization list, they are referred to a placement, and then they are placed in that housing. And, we provide those resources and supports to help them succeed and thrive and, keep on their journey to, their individualized goals. That is the general framework of coordinated entry. Once again, those are the bare minimum. That's what that's the framework and the structure that we build that local process around. And I will just say that when we talk about equity in coordinated entry a lot, especially at the national level in that conversation, it is very focused on the assessment process, because we have seen a lot of those disparities and inequities in how assessment is conducted. That is an incredibly important conversation that we need to continue carrying forward, but we need to be thinking about equity at all of those points, or else we're going to continue to see disparities. We need to be equitable and accessible in those entry points. We need to think about how prioritization works, how referrals are made in an equitable way, including things like case conferencing to make sure people get the right interventions. So there's really a lot of aspects to coordinatory that need to work together to support that really individualized and effective flow through the system from that experience of homelessness into safe and stable housing.
Thanks, Alicia. And Enrique, can you talk a little about how coordinated entry is rolled out in this community here in San Benito County and Monterey County?
Yeah, thank you very much for the question. Ending homelessness is not an easy task, let alone reducing homelessness. The Lead Me Home plan to reduce homelessness over a 5-year period in San Benito County is building at least 190 new units. That in itself will reduce homelessness. But in order to help with reducing homelessness, or hopefully someday ending homelessness, this coordinated entry system is a system that really provides support and additional housing resources for those that we work with in San Benito County and in Monterey County. What our goal really is that every person that we touch at the program level is entered into coordinated entry, and that alone is not an easy task, because in working with homeless individuals, it's not just them knocking to the doors. You got to go to them, and going to them it varies. It's not just going to the shelter or going downtown. It's really looking at where do they congregate and providing outreach. And outreach doesn't mean just going once a month or once a week. It has to be the consistent outreach that's needed to build rapport, engagement. Because I could tell you this, most individuals will not complete the assessment right in the back. No, that's not going to happen. So part of what we're trying to do in San Benito County is really expand outreach efforts that leads to trust and rapport, and therefore getting them into coordinated entry, because the system, the way that it's set up to work. I mean, think about it, placing someone into housing with limited resources and extremely high rents and just such a low housing inventory, it's not an easy task. But when you have individuals in coordinated entry, all of a sudden it really opens the doors that beyond San Benito County, with limited resources, it opens the doors to other housing options in the region. And the same goes whenever we have housing availability going through coordinated entry, we house anyone within the region. So it's really set up in a way that it helps everyone. So I'm not sure from here how many really understand coordinated entry, but in a nutshell, it is set up to work as a region. So I'd be interested to see like how many residents in San Benito County have been found housing here in Monterey County and vice versa, because that's what it's meant for. There's resources, although they're limited, but it's certainly an option for us to continue to work with coordinated entry and having the staff that's trained to always make it a goal, like I said, to get everyone in coordinated entry. And that is the key. And that is a challenge, like I said, and we will continue to work towards that, because the more we get in coordinated entry, the more households, individuals that will get into housing. So that's what we've been doing, and a lot of training and a lot of attention to that, and working with the Community Action Board as well to get a racial equity policy, racial equity committee to address inequities and disparities. And so those are things that we're doing in San Benito County.
Thank you, Enrique. I've got more questions for the panel, but I'm going to take a minute to ask some questions of you all. Who here works for or operates an access point to coordinated entry, either outreach or a call center or a drop-in center? Who works for access points or participates? Who does assessments with folks? Okay, some more hands. Who's taken an assessment? Are there folks here that have tried to get through coordinated entry by doing assessments? Okay, great. It's important. We want to hear from you. Who has been part of the prioritization decisions in your community? Who's heard the phrase getting to the top of the list, right? Is that a common, right? So prioritization decides what factors of need in a person's life make them a priority for assistance with housing. Who's been part of making those decisions? Okay, they happen by magic then. No one in the rooms participate, right? So this is an issue, right? If we're going to make good prioritization decisions, there should have been more hands going up in this room. And then who has been part of decisions about matching or referring people to housing? Okay, some folks sitting in case conferences. So those are the components of coordinated entry: the outreach and the access. So the street teams, the call centers, the drop-in places, and the assessors that do the questions and put the information into the homeless management information system. And then the Wizard of Oz, somewhere in the background, does prioritization. But the truth is, HUD wanted communities to make those decisions. Where is the greatest need? Who has the highest barriers? Right. Okay. Right. The folks that are working for the Wizard don't want any of you coming up to them, lobbying them to get to the top of the list. But the point is, we want transparency in the community. There are not enough resources yet, but we're all fighting so that there will be someday. But now we have to decide who gets the available resources. And that's what that prioritization component is. And it should be transparent, about why we have decided this as a community. So, and then of course you want to match folks to the resources. So those are the elements. And when they work well, they do exactly what Enrique said, which is get people access to housing in a broader range of options faster. However, it does not always work that way. Who's noticed it does not always work that way? A few more hands now. Great. So I'm going to ask Moriah to talk a little bit about some of the flaws that she has seen from her vantage point, particularly around equity and coordinated entry.
Wonderful, thank you. So as I had mentioned in my introduction, we serve 8 federally recognized tribes in Northern California. That's across 3 different counties. So our social services team has to have licenses in 3 separate systems, and each system has a different prioritization. Now, although our team has been working to be able to access HMIS, we still are not a point of access for coordinated entry. Why is that a problem? Tribal communities understand themselves. How many people here know of 3 federally recognized tribes in California? 1 person. 1 person. 2 people. Great. So when you think of homelessness, Native Americans were the very first homeless people on this continent, and they're not at the table making these decisions. They're not being reached out to. So systematically, that's a huge issue. Now, homelessness in tribal communities is very different than what you see in downtown LA or San Francisco, or potentially even in the city of Salinas, right? Tribal communities are often in areas of land that are unbuildable. They are government scraps, and oftentimes they're not ancestral territories because that's just the land that the government gave them to live on. Now, when the pit count occurs, how many COCs go out to tribal communities or have access to ancestral lands and approach tribal members in a culturally significant and meaningful way? Trauma-informed care, with in mind the genocide that has happened throughout this state. Lands were taken from Native Americans throughout the nation. And here in California, it was in state policy. So ensuring that tribes have a seat at the table to discuss prioritization, to find ways to empower our incredible staff that are working in homeless communities, working directly in encampments. How do you have meaningful outreach approaches? Where do you go? Who do you connect with? So one of the greatest flaws that I see is that tribes aren't at the table. As I had mentioned earlier, there's 110 federally recognized tribes in California, and our membership isn't designated to one jurisdiction, right? The CFC can potentially have multi-county or the one county itself, and that's who they focus on. Tribes are not that way. We have members throughout the nation. We have members scattered throughout the state. And the way the system works, it creates these invisible borders. That is a colonized approach to ensure that people do not have direct access. So one of the reasons why I was so honored and privileged to be here today is to have that said. I hope that each one of you goes to your manager, leaders, local politicians, advocate for the people who don't have a voice. Advocate for the people who were the first homeless people on this continent. So some of the flaws are just that there's no communication. And it goes both ways. You know, I encourage all of the tribes that we serve to reach out to the locality because it is a government to government conversation. And as you know, the panel has stated, is that there are national kind of statutory requirements for coordinated entry, and then it falls to local. So oftentimes outreaching to tribes is checking a box. Oh, I talked to a tribal member today, and you know, their cousin's on council, so that is meaningful consultation. But unless HUD, and I say this respectfully, unless HUD creates statutory requirements for each COC to not just check a box, but to have meaningful interactions, we're doing a disservice to this nation's first people. Short story long. Thank you. Thank you.
So that's some tough medicine to swallow, true medicine. And it's not the only truth about where coordinated entry has not achieved the equity it's aspired to. So I want to ask Alicia to speak sort of more broadly to some things she's seen in her TA role.
Yeah, so I alluded to this earlier, but assessment is one of the areas we've seen a lot of concerns and a lot of inequities. And a lot of that's because we saw a use of one tool that kind of became a national standard. And that's not, we can't apply one tool to the local situations, all of the really specific situations and circumstances and vulnerabilities and needs that we see not just in each locality, that we see across different populations of focus. It needs to be not just locally driven. The entire assessment process, and not just the assessment tool, needs to be developed with authentic engagement of people with lived experience. That is at the core one of the biggest issues we've seen, is that people with lived experience aren't engaged in conversations about redesigning and refining the system that is so crucial to how you access services and when you access services. And many of the panelists have spoken to this. We need to have trauma-informed care because you are asking people deeply personal questions. You are asking them to share parts of their life with you. And you need to build that trust first. You need to have a process where people can build trust, engage with you. We want to ask people to share their story as few times as possible, to give only as much information as is needed, and to really support them all the way through this process so that it doesn't feel like you're just kind of moving through a conveyor belt. Like, you are an individual and your individualized needs are being met in the best way that we can. So those are some of the kind of underlying core issues I've seen with where coordinate entry sometimes just doesn't work for communities.
And you were very nice and didn't call it out by name, but VI's for that.
Yeah.
Is that a set of letters people know? Who's heard that set of letters?
I just couldn't explain all the acronym parts of that. Like, I don't know what it fully stands for.
I know at this point we don't know what those letters mean, but we all know most of us know what we're talking about when we say VI's for that. And one of the things that's happening in communities across the country, including this one, is saying, okay, thanks, that got coordinated entry off the ground, but we're ready to do our own thing, take our own knowledge, build our own tools. And so that's a really important part of equity. And as we move forward building our own tools, we need to have the right folks in the conversation about those tools, and not just giving input, but helping to decide the tools and the prioritization.
Yeah, and just one thing to add to that is that another kind of pitfall I've seen in communities is thinking that coordinate entry is one and done, or it's static, and like it should constantly evolve, and it should be, we have those annual evaluations, but you should be getting feedback from participants all the time. You should have open conversations with the case managers, the outreach workers, the providers. It is okay for coordinate entry to change, to evolve, for you to try things and for them to not work better, for things to kind of fail and then rebuild and revise, because your community is going to change, the needs of people are going to change, and your system needs to change with it.
Yes, great point. And I'm going to ask Enrique to comment about what evolutions are happening locally, but I'm first going to ask Ed to verify that people that try things that don't work in coordinated entry don't go to HUD jail.
I think that's an important point to make. Like, these are community-driven approaches, and your learning from what we know works is important, but also what we try to know doesn't work. So I think that's something that we need to make clear, that we have space here to work, to innovate further. And, we've learned a lot too. So, and I'll certainly talk to that later on, but we do have additional resources from other communities, folks like yourselves who have are trying different things, and we're seeing good stuff come out from a number of communities in our cohort groups.
Thanks, Ed. And Enrique, how are things evolving here in this COC from the early days of coordinated entry to now?
Okay, so I said a little while ago that coordinated entry works, and I still believe in that. But it doesn't mean that it's a perfect system. It doesn't mean that it works in every community. So just to share what our experiences, what we have seen, what's worked, and what are some of the things that may be some hiccups. Just San Benito County, based on the last census, we had 357 homeless individuals. One of the interesting things that we saw is that 56% of the count were individuals living in their RVs. 56%. We've never seen that. Now and it doesn't end there. That's you're looking at as well 11% in their vehicles. So what is that, like 67% or so? I mean, that's huge. So if we wanted to have a perfect coordinated entry system, we gotta like make sure that they are assessed, that they are entered. But they're so mobile, so that alone it's an issue. It's difficult to get to all of them and build that level of rapport that we need to. Now, one of the things that whenever we have the need for referrals into our programs, there's some hiccups, and I have to admit that there are some hiccups. Lists that we get, we need to ensure that referrals are willing to relocate to San Benito County. San Benito County is a small community with a population of approximately 62,000 individuals. There's some cities, City Hall, San Juan Bautista, Tres Pinos, and they all congregate in different areas. So we need to make sure that individuals that are referred are willing, because what we've been finding is most of them are not. They're saying, oh, San Benito County, we don't want to go there. So I think in the back end, we need to make sure that referrals are made that are for individuals willing to relocate. And second is, how can we best capture residents that are also being referred to us? So that could be part of our end, with the entry points, with those that are completing the assessments to perhaps do a lot more in our county. But doing that, it's an enormous effort. With staff training, if staff turns over, we gotta retrain again, and we gotta make sure that we cover all the different areas of homelessness. There's the river that runs miles and miles that we need to make sure that we connect with them. The parks behind the railroad, behind abandoned buildings. So it's very complicated. But I think having consistent policies as a region and getting referrals that individuals, better quality referrals, should I say, that would make a huge difference. So increase our local entries into cars, and also better quality referrals into our county. And I believe that working together, we can certainly improve the system and have more people in discussions with policy and so forth. So.
Thanks, Enrique. And those are great examples. And in fact, that comment about referrals is such a great example of why it is important to have people experiencing homelessness at the table when you design things. Because having questions about where do you want to go are good questions to have as part of your assessment, so that you make matches that work for folks. And if you want to make matches that work for folks, you got to talk to the folks about the kind of matches they want. So that's a great illustration of equity in design. But I'm going to ask Moriah to make another recommendation about improving coordinated entry, and then Alicia, and if either of you gentlemen want to build on those, feel free, and then we'll turn it to you all.
Wonderful, thank you. So just to provide a little more context as to tribes, and then I'll get to my suggestion. Not every tribe is a gaming tribe, meaning not every tribe has a casino. Not every gaming tribe is a wealthy tribe with this endless, bottomless pit of funding to build extravagant units. So almost every federally recognized tribe in California is dependent upon funding, grant programs. In the last 3 years alone, we've brought in and secured approximately $56 million to support additional units, to provide social services to our membership. And here's where my referral or my suggestion comes in, is in coordinated entry, in HMIS, any kind of homelessness data collection system, when you check the box for Native American, you need to have a drop-down menu that says which federally recognized tribe. Why? Because with those $56 million, we've been able to secure home key funds to build units. We've been able to secure emergency solutions grant. We have housing assistance, or we have the HDAP program, Housing and Disability Advocacy Program, bringing families home, where we can directly work with our Indian Child Welfare Act staff who are working directly with Indigenous youth. And we also have Home Safe. So if that drop-down menu does not exist, you're just continuing to that systematic leaving tribes out, right? Just with our 8 consortium tribes at Northern Circle, we have 546 on our own coordinated entry system, right? On our waiting list. Now, at the locality, potentially these members are in the thousands. They may not be at the very top, but if there was a referral system where they can come to the housing authority or to the tribe, potentially that member can be housed faster than they could within the coordinated entry system. So without that drop-down menu, we're doing a disservice. We're just continuing and contributing to homelessness, and we're doing a disservice to the people experiencing homelessness.
Thanks, Moriah. Alicia?
Yeah, so I think, as we are centering equity in coordinated entry, transparency is a huge part of that, as Elaine mentioned. So, and that evaluation piece. So just continuously thinking about not just who is and isn't accessing housing or the homeless response system, who is and isn't getting housed, but also who was at the table for decision-making processes along the way. And that includes incorporating people with lived experiences, incorporating people with different backgrounds, needs, identities, like making sure that this process is really incredibly locally centered and grounded. And then I just also, I think there is this piece when it comes to equity in coordinated entry that we can't create new units through coordinated entry. And coordinated entry is, taking what we have and trying to essentially like maximize our efficiency. So while we're working on coordinated entry, I mean, looking at what we can do regionally to support new innovative ways of adding our housing stock. I know, we're a little bit outside the bounds of the coordinate, but we can't make those matches effectively and efficiently if we don't have the resources that meet people's needs appropriately. So it has to work together.
Saying that.
Well, just to reiterate the importance of working together, establishing partnerships, and again looking at our local level and our regional level, we cannot do it alone, and we just have to continue to work with organizations, with local key stakeholders, board of supervisors, city hollister. We are not alone, but working together, we can accomplish more. In San Benito County, there's different jurisdictions. with a city, school district, and there's homelessness in every level. There's also many homeless families that are not even under considered chronic homelessness per definition that are not even counted, I think. So homelessness, it goes way beyond what we do here. So to solve homelessness, it's gonna require a tremendous amount of effort, and it is happening. There's been a lot of support at the state level with all the different funding and coordinating with the COC and all the different partners. We just have to keep moving forward and continue to update, make issues prevalent to the Board of Supervisors, to city councils, and all the different partners, and not to give up, because we're here together, with all of us. And many people don't quite understand the issues, what homeless individuals face, being sons of someone, being parents of, they have a life, they have feelings, and it's easy for us to kind of not take into account those things because we go home and to warm bed and shower and access to other resources. But we want to continue to work together as partners and with federal agencies and state agencies. And so anyways, just wanted to mention that because we're on the right track. We just got to keep going.
Thank you so much. So the last thing I'm going to do is invite Ed to share some of the resources and new initiatives. HUD doesn't just make rules. They come to the table with resources. So I'm going to invite him to share those. And then we're really interested in your ideas and questions.
Thank you, Elaine. Thank you, everyone. Honored to be with you today. I'll be quick. How many of you are familiar with the HUD Exchange platform online? Great. I see some hands. So for those of you that aren't, go Google HUD Exchange or just put it in your browser. It's a wealth of information on a variety of topics, but specifically also on coordinated entry and equity. I'll mention 3 resources. I mentioned one about our 2 cohort groups across the country. Our Office of Special Needs Assistance Programs, which administers HUD's targeted homelessness assistance, has had 2 rounds of coordinated entry and racial equity demonstration initiatives. The first round has been completed. We've published a impact and evaluation report that includes evaluations of 8 communities across the country. Where round 2 is currently in process, so that will be a invaluable resource. And again, this isn't HUD telling you what works or what doesn't. This is coming from the very communities such as yourselves that are doing the work on the ground, and they're iterating on this at the local and regional levels. So take advantage of that information. Also, there is a training online. It's lengthy but substantive and applicable. Coordinated entry as a tool for equity. If you need training that's specific to the nation's fair housing laws, the civil rights laws, and how they need to apply in the coordinated entry process, that training will be helpful. It provides an introductory review for you in terms of the key concepts and contexts that we need to be familiar with when implementing coordinated entry. And then it also identifies best practices, right? What we've learned. We have years now. We have clearly a lot more to do, but we've learned a lot as well. Lastly, I'll mention the catalogs. These are previously called toolkits, but essentially it's a compendium of sample catalogs, again, that we've put together, and that as of 2023 includes coordinated entry tools, policies, related documents, all generated from continuums of care across the country. And really the goal here is to provide examples where communities that are different in scope and demographic have had some progress in the space. So again, doing what we can to not just regulate, but also to share what we've learned. So and certainly you can call on me. I'll take your input back and raise it, and hopefully we can see some more meaningful change. And certainly we want to be a part of that in partnership with you.
Let's give a round of applause for this great panel. Thank you all so much. Before I became a consultant, I ran an emergency shelter and housing program for 15 years, and I ran a continuum of care just north in Alameda County. And I was so busy doing the work that I spent years not going on to HUD Exchange. And I just want to say, go on HUD Exchange. It does not read like the federal regulations. So when you think of reading something from the federal government, your eyes might roll back in your head. Sorry, Ed. But I am telling you, HUD Exchange is actually for real, a resource. The catalogs are great, the trainings are great. You really can learn things about HUD's expectations and get samples from sister communities that are doing the work too. So little pitch for HUD Exchange. I waited too long in my career to go there, and now it's up on my VAR and I can open it just like that. All right, any questions for the panelists? Yes. Can someone come up and grab? Yay. We'll keep one up here, and thanks, Ed. Nice. Sprinting with the microphone. And you don't have to just ask questions. If you're trying something that works, that you're proud of, please share it too.
Cool. Hi. Thank you for your wonderful presentation and all the amazing work you all are doing. My name is Josh Madfus, and I work at our United Way in Monterey County. My question is about data sharing and interoperability. And in light of all the amazing statewide initiatives that support whole person care and data sharing and closed loop referrals, like the data exchange framework, like CalAIM, and also just all the data entry that frontline workers are doing and assessments, I wonder if there is a plan for better data sharing and better interoperability between systems like electronic health record systems, health information exchange, community information exchange. Here in Monterey County, we have an amazing closed loop referral software. Just wondering if you all have thought about ease of access and ease of data sharing amongst those systems.
Okay, first, let's give this guy a gold star for the trickiest question in the room. Do any of you all have thoughts on data sharing? It is the vein of social service work, is sharing data and protecting confidentiality and safety of information. And it is definitely a not yet solved challenge, but a vital one to get better at. But do any of you have particular suggestions or thoughts about that? We're like not the data people, unfortunately.
Yeah, so it's a great question. And I can say that it's not something that we're seeing at a national level a lot of, but some communities have cracked the code on it. I think Pittsburgh, Pennsylvania in particular, has a really great kind of interoperability between those systems. It took a long time and a lot of conversations. I think this gets back to, we need to be having the right folks at the table for decision-making processes and planning conversations. So making sure that everyone is there for those conversations and talking in a lot of detail about what this looks for the systems, for programs, and then for participants and clients on the back end, because we want to make sure that it's as seamless for them as possible. But as we were talking about equity in Quinn Antry, we are really, we were talking about equitable access to housing and services. I think health equity is so crucial to that conversation, and making sure that those resources and access to health resources, the other resources available and that are needed by people who are at risk of experiencing homelessness, are connected as much as possible. That's where it gets back to that earlier conversation as well about, what HUD has regulated is like the minimum. We want to go above and beyond and innovate. And that is something that Monterey could take a lead on. So something that you absolutely look at some national, what is happening nationally, like what Pittsburgh's doing, but absolutely something that can happen.
over here.
Hi, I'm Pam Marino from the Monterey County Weekly, and I just wanted to share that. So I'm on the outside looking in, and I've been covering homelessness for several years. And I have personally watched several older adults become homeless in Monterey County, especially on the Monterey Peninsula, because they don't meet qualifications on VSPAT. They don't have a mental health issue. They're not escaping domestic violence. They don't have a drug issue. And they don't meet the criteria. And yet, I would think they're a protected class because they're an older adult. So I guess my question would be, how could it be improved so that those folks don't fall through the cracks? I just spoke to a woman last week who is in her car when previously she had housing, lost all her money, and she's like 72 years old, I think. Yeah.
Tackle that if anyone else wants. So you raise a number of important points and dynamics in our response to homelessness and economic vulnerability in our nation and our region. I think later on today's agenda, there is going to be a report about a study on older adult homelessness that was based up in Alameda County, actually. And one of the striking things about the survey of adults over age 50 who were homeless is that almost half of them lost their housing after age 50. So they didn't age on the streets. They had an economic crisis that dumped, or health crisis that dumped them out of the housing market. That is obviously horrible and something we need to do something about. The challenge is the mandate about coordinated entry is really focusing on folks who are literally homeless. So one of the things that we tend to do in our country and our thinking about social issues, this is just now my personal opinion, is to dump all of the problem down on the least resourced system. So homelessness is an under-resourced system, and to then account for prevention upstream, we absolutely have to do it. We need to advocate for it. We know that during COVID, when prevention dollars were infused into the economy, more people kept their housing. So we should talk about it, but not in the terms necessarily that it is the homeless system's job to work further upstream, helping more people with the same level of resources. So I realize that is not a practical solution for the woman you spoke to, but it's a philosophical underpinning we should keep in mind. If we are advocating to help more people, we have to advocate double to have more resources to help more people, not spread the little tiny pie we have more thinly over folks. Anybody else want to?
Just a quick comment. What I would advise if this happens, there's service providers organizations. So first of all, make that referral to a service organization. It is our job to do as much as we can to get someone at a better place, whether it's other resources, maybe hotel voucher for the night, 3-night to get him freshed up. And that is not a permanent solution, but it is something that immediately some organizations may be able to do that. There might be some shelters that might have availability, and given that some may not be willing to go to a shelter, but that is also an option. But also, I think for me, what most can we do to get get this person into cars to widen the level of services available to our community. So that's what I would advise. Work with local organizations because they might have some resources available to them.
So my apologies. This session is supposed to be over, but it was such an important topic, and we are around at lunch. Come approach us with your questions and your thoughts, and thanks for hanging in for overtime. Have a great day.